Yeah, good evening, all of you. Yeah, good evening, one and all. Now, our session is regarding the exam preparation of physiology. So, so when it comes to the total marks for this paper is 80 marks. So, for this one, you are going to get long questions. Two long questions you are going to write. For that, if one bit, they'll give choice. Two essays will be there. Either any one of essay you have to choose, and you have to attempt you have to present that one. So, if you write one answer here properly, you're going to get 10 marks. In the same way, two bits will be there. Okay. So, in first bit, A or B, any one of them you are going to write, which is going to carry 10 marks. And in the second bit also, A or B, you are going to write only one among those two. Okay. So, by that, you are going to get 20 marks. Then next is the short note questions. Here you are having uh, for this one, 8 questions you are going to write here. There won't be any choice in this one. And each question will carry 5 marks. Total 20 marks here. Okay. 8 questions and 5 marks for each question. So, so listen once again. 5 marks each question and the 8 questions will be there. You are going to get 40 marks here. Then brief questions, 2 marks questions also will be there. In that form, you are going to write 10 questions. Each question will carry 2 marks. There won't be any choice for the short questions as well as very short questions also. So now simply we will discuss how you have to present by taking one question paper. So when it comes to 10 marks question, here I'm taking one previous question paper and I'm going to brief how you need to present for the 10 marks. So here in first bit, either A or B, any one of them, which one you are thorough, that question you have to choose. Okay, so here A is discuss the mechanism of formation of concentrated urine and add a note on diuresis. So if they ask the 10 marks for this one, you have to how you have to present, you have to write about the counter current mechanism. Under counter current mechanism, you have to write the counter current multiplier as well as the exchanger, and how the uh, concentration gradient is medullary gradient is going to uh, medullary gradient is going to be maintained for the reabsorption of solutes and the water, and for the dilution also. So when the reabsorption of solutes is going to occur, at the concentration of the urine is going to be reached. And here you are writing counter current multiplier, exchanger, and for example PCT, loop of Henle, DCT, and the collecting duct will be there. No, so so what are the pumps are going to be there? and effect of hormones for the reabsorption of the solutes you have to attempt here, right here. And after explaining all these things, you have to write a note on diuresis. Means what is meant by diuresis? What is the mechanism of action? You have to mention some diuretics. Okay, in this way you have to attempt if question under question number 1 A, you have to attempt like this. Okay, then if one more is B, discuss the uptake of oxygen by the blood and the factors that determines its dissociation. So among these A or B, only one you have to write. You should not write like A and B of this one, and you should not leave the second bit at all. Okay, among the A and B of first question, you have to write any one. Okay. So when it comes to the first question B, so regarding the uptake of the oxygen by the blood, you are going to write under this one how the oxygen transport is going to occur. Okay, so for this one you have to write the pressure gradients from the atmosphere to the blood and from the blood to the alveoli. Okay, and hemoglobin saturation and oxygen hemoglobin dissociation curve and partial pressure at P50, partial pressure of 50, that one you have to mention, and loading and unloading of oxygen based on the oxyhemoglobin dissociation curve you have to write here. Then shifting of the curve to the left and right, and what are the factors affecting the shifting of the curve to the left as well as the right, you have to explain here. Okay, and the oxygen dissociation curve you have to label it properly, and what you need to write for the x-axis and y-axis you have to mention there. Okay, in this form you have to write the question B under question number 1, discuss the uptake of oxygen by the blood and the factors that determine its dissociation. Okay. Uh, then, so regarding if you need more information, how you have to present, how you have to prepare for that one, you can go to our Prakara module, Prakara exam module. So where you can ready, you can study the content thoroughly, and more description will be there. Okay. Then next is we have done with the 10 marks question. That is the first question. Either A or B, any one of among those two, you are going to attempt only one. So many students, they'll write like in first question, they'll write A and B and they leave the second question. You should not do like that. Okay. So when it comes to the second question, among those A and B, any one of the question, you have to present it properly. Here, when it comes to the question number, question number 2A, give an account of various factors involved in the blood coagulation. How it is going to be prevented from clotting in the vascular system. Okay. So here, various factors involved in the blood coagulation. For this one, you have to write the intrinsic mechanism, extrinsic mechanism, means intrinsic pathway, extrinsic pathway, and common pathway. That cascade mechanism, you have to write it properly, and the effect of enzymes on that reaction will be there, no? So the enzymes, you have to mention it properly, okay, for intrinsic, extrinsic, as well as the common pathway. Then, how the prevention of the blood clotting in the vascular system. There, you need to explain, means inside the blood vessels, how the blood clotting is prevented. Mm? Intravascular coagulant, that is synthetic and natural intravascular coagulant, you have to mention, and the mechanism, how the prevention of the coagulation inside the body intravascularly, you have to write. Okay. In that form, you have to attempt our question number A. Then next is B. Draw a labeled diagram of corticospinal tract. Explain the effect of decerebration on their function. Okay, so here for this question, you are going to write the corticospinal tracts from the cortex to the till the spinal cord, means corona radiata, then internal capsule, and pyramidal, extra pyramidal, anterior corticospinal, and lateral corticospinal tract, and how the pyramidal decussation is going to occur, and how they are going to end on the spinal cord. All these you have to make a flow chart as well as the diagram and label the diagram properly. Then you have to explain that one from from which neurons of the cerebral cortex it is going to start arise, and when it is coming down, what are the changes, what are the decusation, how much of how many fibers, like 80% and 20% they are crossing to opposite side, no? So that points you have to mention, and downwards when where you are going to explain it as anterior corticospinal tract and lateral corticospinal tract, and on the which neurons of the spinal cord it is going to end, means terminate, that points you have to write, and decerebration of their function. If any, at any level, if any lesion occurs, how it is going to be manifested. Okay, that one you have to mention. Decerebration on their function means at the level of the spinal cord, or else at the level of the medulla, and at the level of the cerebrum, or else the internal capsule level. If decerebration is going to occur, how it is going to show the symptoms, signs and symptoms, or else the clinical features you are going to explain there. Okay, so this is regarding the B question in that question number 2. Next, we are going for the short questions. Here, female contraceptive pills and the mechanism of action. Here, when it comes to the for this, in the second bit, first question, what is meant by contraceptive pills? You have to write. Then, in females, what are the contraceptive measures? Okay, what you are going to combined pills, combined pills and mini pills, micro pills, and their composition, how you have to use that one, and how the mechanism of action is going to occur for the prevention of the fertilization. All those things you have to write under the first question for female contraceptive pills and the mechanism of action. Here, the mechanism of action you have to draw in a flowchart manner. Okay. The next second question is the molecular basis of the skeletal muscle contraction. For this one, you have to write the actin, myosin, and troponin, tropomyosin, how the nerve impulse is going to reach the muscle, cross bridge formation, power stroke, all these things you have to write, and how the from the sarcotubular system, how the calcium ions are going to reach the actomyosin complex because of the movement, because of the power stroke, how the binding site is exposing. All those things in a flowchart manner you have to you have to draw there, you have to present there, and the diagram of cross bridge formation and the power stroke you have to draw there. Okay, and label it properly. By that you are going to get full marks. That is the 5 marks for this question. You are going to get it like that. Yeah, this is regarding the molecular basis of skeletal muscle contraction. The next question is the surfactant, its composition and its function. Okay, so for this question, you have to write like from which part surfactant production is going to occur. Means the type 2 alveolar epithelial cells are going to produce the surfactant. That point you have to write. What is the composition? In the composition, definitely you have to present the dipalmityl phosphatidylcholine. Okay, phospholipids, apoproteins, and the calcium ions will be there. No, so among that one, this dipalmityl phosphatidylcholine you have to mention compulsory. Okay, so yeah, all the composition you have to write in a point-wise manner instead of continuously like sentence formation. You have to one by one in a point-wise. You have, by keeping the composition side heading, you have to write all these things. Under phospholipids, dipalmityl phosphatidylcholine you have to mention, and next under the side heading of the functions you have to write what are the functions. Okay, it is helping for decreasing the surface tension. Okay, so like that other functions also there, no, but the first primary function is to decrease the surface tension. That one you have to mention, and all other functions you have to mention. Then just keep a side heading like applied physiology. Under that one, adult respiratory distress syndrome, and in children also respiratory distress syndrome is going to come, no, infant respiratory distress syndrome or the hyaline membrane syndrome. That one you have to mention. Those 2 points if you are going to mention, it will be very effective for the examination, for the person who is correcting that one. You will get full marks. If you are writing about the applied physiology and acute respiratory, like acute respiratory distress syndrome, adult respiratory distress syndrome as and the same respiratory distress syndrome in infants, or as the hyaline membrane syndrome. If you are writing like this, you are going to get full marks. Then next is the fourth question, write about the pathophysiology, prevention and treatment of the erythroblastosis fetalis. Under this erythroblastosis fetalis, pathophysiology you have to write. Means what is the cause for this erythroblastosis fetalis and in whom, whether it is in the adult or else in the infant, it is going to be visible. Means it is saying that fetalis, means in the fetus it is going to be visible. Why we are saying it as erythroblastosis? Means the maturation of the erythrocytes is going to be affected. No, why we are calling it as erythroblastosis? We have to mention, and the clinical features. And here the irreversible damage occurs to the brain because of the damage to the basal ganglia. Okay, so that is called as kernicterus. So that basal ganglia point and the kernicterus point you have to mention compulsory. Then clinical features of the erythroblastosis fetalis you have to mention. Then and after this one means pathophysiology. Under this one you are writing the what is the cause, mismatching of the RH negative, and when the antibodies are going through the placenta to reach the mother's blood, and that one you are going to write under pathophysiology. Then erythroblastosis fetalis, why we are calling it as erythroblastosis, and what are the clinical features. Step point wise you have to write clinical features of the erythroblastosis fetalis. Then prevention, so how we are going to prevent that one, those points you have to write. Then treatment, means if it is before the occurrence of the problem, if you are going to write some measures, that is comes under prevention. And if the baby is suffering with that one, what is the treatment you are going to give? Under the side heading of the treatment, you have to write this one. Okay. So with this, if you have written like this and mention, don't forget to mention about the point of basal ganglia and connectors. Okay. Then if you present like this, you are going to get full marks for this question. The next question is the fifth one, diabetes mellitus. So what are the cause? Insulin dependent diabetes, diabetes mellitus, non-insulin dependent diabetes mellitus, then juvenile and adult, like that. You have to mention all the classification, means hereditary, or else in sometimes insulin receptors are not going to respond when the hormone production, if it is normal from the pancreas also. So for this one, you have to give some definition. What is the cause and what are the types of the diabetes mellitus? In this one, we are having the two classification, juvenile and adult type. And one more classification is IDDM and NIDDM, non-insulin dependent diabetes mellitus, insulin dependent diabetes mellitus. Then clinical features will be there. You have to list out all the clinical features. Okay, till clinical features, if you write, it's enough. And one point regarding the how you are going to manage the diabetes mellitus. 1 or 2 points. With this, you can wind up this answer. The next is the sixth one, visual pathway. So when it comes to the visual pathway, you have to draw the diagram and you have to make the flowchart also. Okay. So in the flowchart, you have to show the right and left eye nasal part, temporal part, and crossing of the nasal fibers and temporal fibers. What we are going to call that one after the optic nerve, optical tract and optic pathway will be there. No, so what are the fibers are going to be present in the optical pathway and where it is going to be end? When from there, from the tegmen, it is going to reach the cerebral cortex to the occipital path, occipital lobe. No, so all those briefly you have to write it in the flow chart. Then you have to draw the diagram. When you are drawing the diagram, you have to show with the different color pencils, nasal pathway, nasal fibers and the temporal fibers and the crossing point, pyramid. The decussation point will be there. No, so that one you have to label it properly. And along with that one, lesion also means if the damage, if lesion occurs at the optic nerve level, how it is going to be manifested. You are not explaining completely at that point, but you have to make a horizontal line which is indicating the lesion, and whether it is hemianopia or homonymous hemianopia or heteronymous hemianopia, like that one sentence you are going to write there. That's it. You are not going to explain everything, but you are showing with the lesion. Okay. So, so you have mentioned the you have shown the same thing in the flow chart and you are drawing the diagram. In the diagram, you are labeling it properly. And if any lesion occurs, how it is going to be manifest to that subject you are going to show. Anopia, hemianopia, heteronymous hemianopia, homonymous hemianopia, all those things Just one labeling you are going to give. With that, you are going to get full marks for the visual pathway. So next is the functions of CSF. So when it comes to the question like functions of CSF, uh, directly you can just one sentence from the choroid plexus are going to secrete the cerebrospinal fluid. One word regarding the production of CSF you have to mention, and no need to explain how the what is the composition and how it is going to be reabsorbed and all those things. Don't write all those things. Just when they are asking for the functions of the CSF, first point should be the choroid plexus are going to produce the CSF. Then list out all the functions. Okay. So that much is enough for the functions of the CSF. Here you are not going to writing any CSF circulation. That is the waste of time. Don't write CSF circulation. Directly production from the choroid plexus. Then you are explaining the functions. That's it. List out all the functions and explain how the function is going to occur. Like that, functions of CSF with this, if you write, it is more than enough to get the 5 marks. The next is the neuroendocrine reflex. Okay. So when it comes to the neuroendocrine reflex, so here it is little bit of indirect question is this one. So under this one, neuroendocrine means endocrine gland is there. From the nervous system, the impulses are going to reach the endocrine gland. Here, what is meant by neuroendocrine reflex? You have to explain there, and you are going to explain that content under the milk ejection reflex. Why we are saying the milk ejection reflex and neuroendocrine? You have to say in the initial content. You have to say from the hypothalamus, the fibers are going to reach to the this posterior pituitary gland, supraoptic nucleus, and the paraventricular nucleus, and the impulses are going to reach the posterior pituitary gland, and all those things you can explain in that way. And the production of the milk ejection reflex you can explain. Okay, so any one thing like production of the posterior pituitary hormones, oxytocin, vasopressin, you can say, or else you can explain milk ejection reflex. Okay. So when the hypothalamus, the stimulus comes through to the posterior pituitary gland, oxytocin is going to be released. Okay. So our posterior pituitary gland is endocrine, and from the hypothalamus, what the stimulus is going, we are getting to the endocrine gland. That is the neural part. So this reflex you are going to explain milk ejection reflex. So milk ejection reflex from the hypothalamus to the till the production of the milk, you can make a flow chart. By that you will get good marks. Here you have to explain what is neuroendocrine reflex, and you are taking the example of the milk ejection and you are explaining that one. Okay, with this you can wind up this answer. So if you are explaining like this, 5 marks you are going to get. Next is we are going for the 2 marks question, brief questions. Here first one is the diabetes insipidus. So what is the cause for the diabetes insipidus? Here, you should not confuse with the diabetes mellitus and the diabetes insipidus. Diabetes is insipidus because of the antidiuretic hormone. So you have to write the cause and signs and symptoms, polyuria, polydipsia, and all these things you have to mention there. With these 2 marks, you are going to get for cause and clinical features or signs and symptoms. If under that side heading, you are going to write what is meant by polyuria, polydipsia. Okay, those points also you are going to write. This is for the 2 marks. Then label diagram of the nephron. So many students, what we have experienced till now, when they are asking for the nephron, they'll be confused with the neuron. Please don't confuse. Nephron comes under renal physiology, which is going to be present under kidney. Okay. So nephron diagram you are going to draw. So capillaries, around that one means glomerulus, below that one the cup shaped Bowman's capsule, PCT, loop of means proximal convoluted tubule, loop of Henle, descending, hairpin bend, ascending limb, then distal convoluted tubule, and it is coming down as collecting duct. So you have to draw. Then just label it. When you are labeling it also, in all the directions, you should not label it. Everything like right side and arrow should be at the same line. When you are labeling the glomerulus, collecting duct, means from the glomerulus to the till the collecting duct, all the arrows should be on the right side and sufficient space should be there. Then at the same level, all the arrows should end at one line. Okay, then you are showing that arrow. Means you are labeling that one properly. So with this, you are going to get 2 marks. Then next is the composition and functions of saliva. As the direct question, you have to keep the means first point is the saliva is going to produce from the salivary glands. Then you are going to composition and functions means under composition you are having the 99.9% and 0.1% is the solids. Like that flow chart is there in your textbook. So that flow chart you have to write for the composition and mention. Don't forget to mention about the salivary amylase. Hmm? So this is for the composition. And the functions, you can list out all the functions and no need to explain the functions. This is for the 2 marks. Now you are going to list out all the functions of the saliva. Then next is the rigor mortis. So this comes under the muscular system. So what is the rigor mortis? What is the state? What is the cause for the rigor mortis? You have to write. And because of that cause, how will be the muscles? Okay. And when it is going to occur means when the person die, the tightness of the muscles is going to occur. So that is we are saying it as the rigor mortis. No, so cause you have to write. What is the cause for the rigor mortis? When it is going to occur, how it is going to form. Okay, means mechanism of action little bit will be there. So you have to write like that. In 3 or 4 points, you can wind up this rigor mortis. Then next is the fifth question. What are the types of the intestinal movements? Direct question, pendular, peristaltic movements, and all those things you have to mention. Just explain one point. Means what is the basic point? What is meant by pendular movement? What is meaning of propulsive movement, retropulsive movement? Like that, the basic point regarding that one you have to write for the types of the intestinal movement. If possible, write 1 point of usage. Only 2 points for each movement will be enough. Then next is the mention the names and location of the peripheral chemoreceptor. This is also very direct question. Okay. So you have to keep the side heading of peripheral chemoreceptors. Under that one, 2 types will come and name those. Then where is the location? Okay, directly. So name of the peripheral chemoreceptor, where it is going to be present. Like that, in 2 lines, you can finish off. For like if you write the location and the name of that one 1 mark. Like that, 2 are there, you can mention those. Then next is the pregnancy test. So under pregnancy test, 3 tests are there. You have to list out those 3. And if you want to explain chorionic, that pregnancy test will be there, no, which is indicating the presence of human chorionic gonadotropin hormone, no, that one in 2 lines you can mention. Okay, that is the basic one. Main thing, human chorionic HCG, human chorionic gonadotropin hormone, which is going to be present in the urine. You are going to do that. You are going to check that one, whether the pregnancy is positive or negative. So you have to list out all the pregnancy tests and you have to explain this one HCG test. Okay. Then next is the photoreceptors of the vision. This is a very, very easy question. If you write 2 words, you are going to get 2 marks. Okay. Rods and the cones, you are going to mention that one. Then at the same time, rods and cones, you can mention it as the rods for the night vision and cones for the, like that. You can mention rods and cones. Then types of active transport. Here you can write the primary and secondary active transport and the examples for that one you can mention there instead of explaining everything. So type, what is meant by active transport? Types and example. That's it. With this, you are going to wind up the types of active transport. Okay, if you need the complete explanation of sorry, complete explanation of these content, you can use our Prakara's exam module. By that, you can learn all these answers properly with minimum time. Okay. And you can understand how to present properly and what are the points you have to mention in that. Then these are, in this way, you have to attempt all the questions. So, and one more is the, one more common for all the, whether it is essay questions, short questions or very short questions, how you have to present means. So wherever required, draw the flow charts, mechanism of actions, and like any um like mechanism of action, or as any how the hormone is going to be produced as, or as the feedback mechanisms there, wherever possible, write instead of writing in the form of sentence, you can use the flow charts or the mind maps you can mention. And don't forget to keep the side headings, and subside headings. And please do some underline for important points where the important point is there. And at the end of the answer, don't forget to keep one line which is indicating that this answer is done till here. Okay. one line you have to make it. That's it. By that, it will be easy to differentiate your answers. By that, it's easy to get good marks. Then don't forget to keep the question number. Hmm? You have to keep the question number at the left margin, as well as you have to keep the question number above the answer. Means from this point onwards, if I am going to start my answer, just above to that one. Sorry. If it is the second question and A, you have to keep, whether they have kept the Roman number, you have to keep the Roman number instead of Roman number. If they are keeping the normal numerical number to the same one, so don't change to the numerical one to the Roman numbers. So whatever in which form they have given, that one only you have to keep it on the answer sheet on the left margin, as well as on the top of the answer. You are going to make it and circle that one. Mm? That is the important. Definitely you have to do this one, and do the diagrams properly, and before, and don't forget to label that one. And before start your answer, writing of your answers, read the question paper twice. Hmm? And sorry, and whenever you are writing, start with uh, which answer, if you feel that you are perfect in that answer. Okay, so that answer you have to present it first itself. Okay, in this way, if you present your answers, you are going to get good marks. So this is regarding the physiotherapy physiology examination presentation. Okay, if you want regarding full explanation of all the answers, you can use our exam module, Prakara's exam module. Okay, with this, I have done my uh, tricks and tips regarding the physiology examination.